Scleroderma is a rare autoimmune disease, which would occur in the circumstances that when the white blood cells of our own immune system recognize allied domestic cells as foreign invaders and attack them. This kind of disease utilizes a wide variety of approaches to affect our body, including the hardening and tightening of the skin and connective tissues. It is characterized by the buildup of scar tissue in the skin and other organs, which we called it fibrosis. It is estimated that about 75,000 to 100,000 people in the US suffered from this disease, and its origin can be traced back to around 400 BC, when a renowned ancient Greek physician, the father of medicine, Hippocrates, discovered its very existence. The term scleroderma comes from the Greek word sclero, which refers to hard or hardening, and derma means skin. The first detailed description of this disease was done by an Italian doctor named Carlo Cazzio in the mid-1700s. He described his patient's symptoms as hard wood-like skin. There are two types of scleroderma, systemic scleroderma and localized scleroderma. Commenting the introduction of the former, systemic scleroderma is an autoimmune disorder that affects the skin and internal organs. It is characterized by the buildup of scar tissue in the skin and other organs. Fibrosis is caused by the overproduction of collagen, which normally strengthens and supports the connective tissues. The common symptoms and signs include several phenomena. Once your fingers are exposed to cold environments or under pressure, they will turn white, blue, purple, red, and then slowly return to normal color. This occurs weeks to years before the fibrosis of the skin. Fibrosis also affects internal organs and can lead to impairment or even failure of the affected organs. The most commonly affected organs are the esophagus, heart, lungs, and kidneys. It would cause the organs to fail to function normally, which is the main factor of the increase in the disease mortality. Localized scleroderma is characterized by various degrees of skin hardening, and it is also caused by the overproduction of collagen. The latest research shows that the overproduction of collagen may be related to genes that control white blood cell antigens and genes that control collagen synthesis. However, the underlying mechanism of localized scleroderma remains uncertain. Unlike systemic scleroderma, localized scleroderma rarely affects the internal organs. However, it affects the tissues under the skin directly, such as muscles, nerves, and bones. Localized scleroderma occurs more commonly in children and is usually called juvenile scleroderma. Localized scleroderma usually changes predictably over time. For example, let's assume a circumstance that someone's right face has been affected. The following phenomenon will occur. First, the skin of the affected area is slightly sunken, with purple or red lumps. Subsequently, the area of the heart block expands, and the center becomes white. Then the skin of the affected area becomes thinner, tighter, and will be surrounded by a circle of dark skin. Localized scleroderma may be itchy, but it is usually painless. The development of the left face and the right face will be different and asymmetric. Localized scleroderma affects the normal work and development of the tissues, so it will bring many inconveniences to the patient. For example, patients with localized scleroderma on their hands may not be able to grasp objects or write. In addition, it may also affect the appearance, and patients will lose confidence and passion for life. Fortunately, it does not cause death in most cases. Many people avoided direct contact with patients that have been diagnosed with scleroderma and even discriminate against them. However, there is no evidence to suggest that it is contagious or heritable. Scleroderma patients are no different from normal people. They also need the support of family and friends. We hope that all patients can maintain an optimistic attitude and be respected rather than sympathized by others. Although currently there is no cure for this complex disease, yet nutritional treatment and physical therapy can largely improve the quality of life of these patients. In the next video, we will explain the details of current treatments for scleroderma. Hope you enjoyed this video and found it helpful. Bye!